What's going on, everyone? Happy Saturday. Hopefully everyone is doing well, staying safe, healthy. If you had to take a COVID test, hopefully you have tested negative. If you had to take a test for something else, such as RSV, flu, norovirus, or maybe one of the other viruses, I hope you have tested negative for that as well. If you did test positive, I hope you have a full and speedy recovery with no long COVID issues. It is time now for the Saturday edition of the Virus Update for Saturday, December 21st, 2024. That's right, it's the last Saturday before Christmas. We're coming down to those final days, and yes, the viruses, they are still with us. They are still a big problem. They are spreading at higher levels now than they did just a few weeks ago because the weather is starting to turn colder, more people are indoors. It's that time of year. The seasonal viruses come out, and well, of course, there is COVID. COVID has no season. COVID, you can get that any time of the year, and in fact, we did see a big wave of COVID in the United States and other countries back in the summertime, and we're entering another big wave as we speak right now. Want to stay informed with what's going on with all these viruses? Just subscribe to my channel down below. Give this video a thumbs up. Hit that notification bell. Share this video with anyone you know. And of course, leave your comments down below. Alrighty, today we just have just a few news stories. Then we're going to take a look at some data. We're going to take a look at some weekly case levels. We're going to also see something that we missed yesterday, which is New York State. And unfortunately, some not so good news there. And we will take a look at some wastewater sites as well, and emergency department visits. So let's get right into it, shall we? Local schools impacted by rise in respiratory illness. Now, the majority of schools right now are done for the holiday. This is something that occurred over the past week in Kentucky. This is in Paducah, Kentucky, which is western portion of Kentucky. 2 western Kentucky school districts closed early for winter break due to students and staff illness. That's as some other districts face lower attendance, likely due to sickness. Yeah, it's been something we're starting to see pop up more and more frequently. Already, study 6% of U.S. adults have long COVID, and many others have reduced quality of life. Many have a reduced quality of life, which is not a good thing. 2 new studies paint a comprehensive picture of current long COVID cases in the United States, and both suggest the condition limits daily activities for a significant portion of those affected. It's something we knew. It's just more confirmation on something that we already knew. All right, yesterday we got the new data from California. Well, Sci-Fi posted over on X San Diego's new data, and let me tell you, it's not going in the correct direction. COVID positivity rate, that increased from 2.8% to 2.9%. Okay, not a huge increase. What is a huge increase is flu has now spiked to a whopping 14.1% positivity rate in the city of San Diego. Yeah, not good. And you can see here on this map, flu is just rapidly rising. RSV is also rapidly rising in San Diego at this time. Take a look at that. It's literally almost going straight upward, and we still have Christmas, New Year's, Hanukkah, Kwanzaa, Three Kings, all these holidays just yet. And meanwhile, we're seeing a massive rise there. COVID-19 hospitalizations in San Diego currently are at 47, and it says 1.4% is the hospitalization rate. 1.4 per 100,000, I should say. COVID-19 deaths. Take a look at this. 178 have been recorded this year. That's a significant amount. COVID positivity, 2.9%, as stated. And influenza deaths, they have had 10 this year. Hello. Is that telling you anything? 10 influenza deaths versus 178 COVID deaths. Yeah, COVID is still far more deadly than influenza. They do, however, have 78 people in the hospital for influenza. 0 people have died from RSV this year. And RSV hospitalizations currently are at 19. And the positivity rate for RSV is at 9.1% in San Diego. Alrighty, this came out yesterday. Wasn't certain if I was going to show it yesterday. And then thought about it again today. And, Well, I think we will. Louisiana is now forbidding public health workers from promoting COVID, flu, and Mpox shots. Let me explain. So basically what they want is they don't want to do advertising about the vaccines. You know, some of these vaccines, like the flu shot, the flu shot's been around for decades. They don't want it to be advertised. They want it more to be, if you want to get it, fine. If you don't, fine. You do you, but we're not going to tell you what to do. You know how you see the commercials saying, hey, protect yourself from the flu this season, or hey, COVID-19 is still around. Time to go out and consider getting a booster shot. That's going to be a no-no in Louisiana. Some people may agree with this, some may disagree with this. I'm just going to take a neutral stance and leave my opinion aside. Okay? So, yeah, Louisiana, they're not going to be promoting going out and getting a shot. And it's a group of high-level managers at Louisiana Department of Health walked into a November 14th meeting in Baton Rouge expecting to talk about outreach and community events. Instead, that's where this whole conversation came up. All right. In Canada, the viral activity level for COVID is moderate. Flu A is moderate. Flu B is low. RSV is running high at this time. RSV high. That's not a good thing. And reminder, my website is datareport.info. You can join in on the conversation. You can even post. You can sign up to become a free member and do research if you want to. Looking to find out about a study? Lots of them posted on there, and I'm telling you something right now. The studies archive, it's going to get a heck of a lot bigger in the coming months because there's been a lot of studies coming out lately. I'm going to be adding some of them in the coming week or so. All right, taking a look at air qualities in the United States, and we will see that there are still problems on the West Coast and in the central region. The eastern United States is not doing bad today. You can see here, Kansas, Nebraska, yeah, a few air quality problems there. Also, Salt Lake City, something going on there. And trust me, it's not there it goes. California is not doing great today. All right, want to learn more about the climate and weather? I do have another channel where I do that. It is Climate Data Report. Haven't gotten around to posting there today. I hope to get something there tomorrow. Philadelphia had 764 EMS incidents on Friday. That is below 800, and I am happy about that. Taking a look at what is going on with Montgomery County, Pennsylvania EMS calls live right now, and we see there are currently 12 of them. 3 of them are for respiratory emergency. I'm seeing vomiting, nauseous, a syncopal episode, accident, and a few other things showing up. Taking a look at what is going on in Chester County, Pennsylvania, and we do see heart problems listed a couple times, injured person, hemorrhaging, overdose, and EMS standby at this time. Taking a look at the hospital situation in Pennsylvania, not doing too bad, but there are a few hospitals showing up yellow, which means things are rather busy. Taking a look in New Jersey, and we do see Carewell Health, critical care, and it looks like they have reduced staff. Perhaps maybe people are calling out sick. It is getting to be that time of year with a lot of people sick right now. People calling out sick can be a thing. That's the only hospital today with a problem in New Jersey. Taking a look at Walgreens for this week, and the positivity rate for Walgreens is 15.2%. That is for COVID. Taking a look at some wastewater data now. We do want to take a look at a couple of places. First off, if you didn't see yesterday's video, let's look at the national level here, and we can see overall, nationally, things are rising for COVID. Just a little wonky movement there at the end. Pay no attention to that. It is going to continue going up. RSV is high at this time. Also a wonky movement there. We'll have to see what that corrects out to be. Influenza A. And mind you, everything I've listed so far, COVID, RSV, and Influenza A are all listed at high. And Influenza A is continuing to rise at this time. Influenza B is still coming up low at this point. HMPV is low. And norovirus is listed at high at this time. All right, let's take a look at a few wastewater sites. First, let's go down to Miami. We have not checked out there in a while, and we'll do the North Miami wastewater site. COVID at this time is still listed at low. RSV is high, and take a look at that. It's been in the high category for quite some time now. It's done this up down regimen, and it never really got back to low, and it may be starting to rise once again. Influenza A is listed at high. Influenza B is listed at low. HMPV is low. Norovirus, look at that. Still high, but it is starting to drop. That's good. And hepatitis A, several detections of that. Let's make our way up to the further northwest, and we'll take a stop along the way at Village Creek in Birmingham, Alabama. COVID is still low for you. RSV is listed at high. Influenza A is high. Influenza B, HMPV, all low and doesn't even look to be detected here. And norovirus is low as well. Continuing our way to the northwest, and this time I believe we are going to take a stop in Colorado, and let's see what's going on there. We'll do North Parker, Colorado. It's not too far from Denver. And COVID is listed at high. RSV is high, and wow, rapidly rising for RSV. Influenza A, I don't know why it's saying low. That should probably be recalculated at a higher level, but it is saying low, but take a look here. It is rapidly rising at this time. Influenza B and HMPV low. Norovirus, wow, norovirus is really getting up there. That is a really high level of norovirus in Colorado. And now continuing even further to the west this time. And we are going to take a stop. How about we come up here? We did Sacramento recently. Let's go down to San Diego, shall we? We talked about San Diego. Can we view San Diego? Sure, we can view the wastewater there. Since we opened up with San Diego, COVID is showing up low at this time. RSV is high. Influenza A is continuing to rise at this time. Influenza B is low. HMPV is low. And norovirus at this time is rather high. And you can see here, it does look like it may be dropping ever so slightly. Alrighty, moving on from wastewater. Actually, no. We need to be fair, don't we? We need to go up to Michigan, because we have not done Michigan, and we also need to do just one site in the Northeast. Warren, Michigan. COVID levels, wow, they are rising once again. They are really high. RSV is high. Influenza A is high. Influenza B is low. HMPV is low. And norovirus is high and continuing to rise at this time. No Mpox or hepatitis at this time. And taking a look in the Northeast. Where should we go Northeast? How about we come up here to Stamford, Connecticut, and see what's going on there. And wastewater levels for COVID, they're starting to rise pretty quickly. RSV is gradually rising. Both of these are listed at high. Influenza A is listed at high. Influenza B is low at this time, but it is starting to rise. HMPV is low. Norovirus is running high at this time. Mpox doesn't look to be any detections at this time. Alrighty, moving on. In case you did not see yesterday, there have been some changes with latest COVID variants. XCC does lead the way at 45%. KB 3.1.1 is at 24%, and LP.8 has now moved up to 8%, and MC.1, 5%, LF.7, 4%. So there are multiple variants that are trying to contend with each other to make their way up to the top. Really a bad time for that to happen. It's the holidays. You don't want to see new variants during the holidays. We already looked at wastewater. Alright, let's talk about emergency department visits. And we will go state by state. And overall, in the United States, we can see here that these are people showing up to the hospital diagnosed with COVID. So these people are positive. They have COVID, and they are showing up to the emergency department. And overall, nationally, that is starting to rise. Alabama is starting to rise. Alaska is starting to rise. Arizona is actually dropping at this time, as is Arkansas. California, still just bouncing off the bottom, not really rising yet. Colorado was rising, then dropped. Now it's starting to rise once again. Connecticut is starting to rise. Delaware has been rising. It slowed a little bit. Washington, D.C., looks like you're bouncing around a little bit after a rise that you were seeing. In Florida at this time is rising slightly to almost holding off steady now. Georgia is rising. Guam is not rising. Hawaii is not really rising, just bouncing off the bottom. Idaho is starting to rise. Illinois is starting to pick up the pace. Indiana is really starting to pick up the pace. Remember, the Midwest is not doing very well for COVID right now, at least not in wastewater. Iowa was rising, now you're starting to drop. Kansas City, quickly picking up the pace. Kentucky, quickly picking up the pace. Louisiana, not rising all that much. Maine is starting to rise. Maryland is rising slightly. Massachusetts is rising. Michigan, yeah, you were rising, then you're dropping. Is it starting to rise again? Very hard to tell. Mississippi at this time was rising, and it's leveled off a little bit. Montana was rising, now you're bouncing a little bit. Nebraska was rising, then it leveled off, now you're just bouncing a little bit. Nevada is actually dropping some. New Hampshire is rising. New Jersey is rising. New Mexico is starting to rise again. New York State is slowly rising. North Carolina, your rise has slowed down a little bit. North Dakota is starting to rise once again. Ohio is starting to pick up the pace with their rise. Oregon is just bouncing off the bottom. Pennsylvania is rising. We'll see some new Pennsylvania data in just a little bit. And Rhode Island is rising at this time. South Carolina is rising. South Dakota, you were rising, now you're dropping. I don't know, you're trying to rise again? It's hard to tell. Tennessee is rising slightly. Texas is dropping slightly. Utah is dropping slightly. Vermont, you were rising, now you're bouncing a little bit there on your chart. Virginia is definitely rising. Washington, bouncing off the bottom. West Virginia, maybe starting to rise once again. Wisconsin starting to rise, and nothing for Wyoming or Missouri. For whatever reason, they just do not update that on here. Epidemic status 4. Influenza. Take a look here. It's pretty much growing across the entire country in places that are not listed. Chances are it may be growing there as well, with exceptions to Alaska, where it says, quote, not changing at this time. All right, taking a look. Oh, wait, hold on. We got to do COVID as well. And there are a lot of states now with COVID that are growing or likely growing. No state is likely declining or declining at this point. Several are not changing or not estimated at this time. Influenza-like activity. We do have some places now that are going higher. In fact, Louisiana is now listed at very high, and high levels, New York City, Washington, D.C., Tennessee, and Alabama coming in with high, and there are several more states in high. Several now moved up to moderate, and not as many states now listed in that minimal category anymore. We're starting to lose the number. There's still a few, but not as many as there were. There's more moderate and high states than we have seen so far this season, which is not good. New York State, something else that's not good. Usually Thursday is when the data comes in that includes New York City, and that's usually the highest level of the week. Well, yesterday actually went higher than that. That signals New York State's increase for COVID is starting to go up faster now, so just not a good thing. 1,208 new cases were reported in yesterday's update. Taking a look at New York State hospitalizations, 557 with 63 people in the ICU at this time. All right, we do have some data now from CJS 83172. But before we get to that, I have to give you your daily reminder. If you are positive for COVID now, chances are you will have to miss the Christmas holiday gatherings. Why? Because you'll still be sick on Christmas. And at this time next week, I'll be saying the same thing about New Year's and New Year's Eve. If you're sick then, you'll have to miss that. But if you're sick right now, you'll have to miss the Christmas holiday gatherings. I should also add, even if you're not sick, as a precautionary measure as we head into Christmas, maybe you're going to spend some time with some family, maybe a good idea to take a COVID test. You could be in the early stages, pre-symptoms, before the symptoms start, and be positive. You really want to avoid spreading COVID as much as possible. Or maybe it is you're just congested and coughing a lot. Hey, I can raise my hand to that. Maybe I do sound congested today. Yeah, it's been a bad couple of days for my coughing business, but test that as well. You can never be too sure, and if you're lucky enough to pick up one of them multi-tests, get one of them. All right, let's read some data here before my voice just gives out. Anywho, Florida, daily number, 390 new cases and 8 new deaths, and 2,674 cases. See, I told you it's going to give out soon. And 50 deaths reported over the past 7 days, a number of which were from July. New Jersey, weekday number, 521 new cases and 4 new deaths. 2,962 cases and 9 deaths reported this week. New York, this is a daily number, 1,279 new cases and 5,687 cases reported over the past 7 days, to go with 22 new deaths. Puerto Rico, daily number, 146 new cases and 754 cases and 1 new death reported over the past 7 days. California, 55 new deaths reported for the week. This is a weekly update. Here's their total number of deaths from the pandemic. This is just not good. 110,010 total state-reported COVID deaths since the pandemic has started. Iowa, 9 weekly new reported deaths to the CDC. Idaho, weekly number, 606 new emergency department visits and 5 new deaths added to the CDC data tracker. Illinois, weekly 476 hospitalizations. Not sure if that is new or current. That could be a current number. Honestly, I don't know. And 6 deaths reported to the CDC data tracker. Kansas, weekly number, 6 new deaths reported to the CDC data tracker. Louisiana, weekly number, 1,126 new emergency department visits and 10 new deaths. Data for LA from September 29th to 2024 present come from the CDC data tracker. Missouri, weekly number, 199 hospitalizations and 8 deaths reported to the CDC data tracker. Mississippi, weekly number, 14 new deaths added to the CDC data tracker. Montana, weekly, 538 new cases and 6 deaths reported to the CDC data tracker. Nebraska, weekly, 409 new positive tests and 8 new deaths reported to the CDC. Pennsylvania, my state, I said we had some data here, and here it is. 728 CDC reported hospitalizations and 31 deaths added to the CDC tracker. Texas, weekly number, 1,488 new cases and 9 new state-reported deaths. Wisconsin, 932 new positive tests, a 7.9% test case positivity rate, and 10 new deaths reported to the CDC data. West Virginia, a weekly number, 739 new positive tests and 9 new deaths reported to the CDC data tracker. That to me seems like a high number for West Virginia, especially the number of new positive tests, considering this day and age, either people don't test or they use the at-home test. And finally, he added 576 new deaths have been reported this week, and currently shows the total for the pandemic being 1,213,622 total U.S. deaths since this all started, up from 1,213,046 it was showing last week at this time. That does come from the CDC. Alrighty, folks, that does it for the Saturday edition of the Virus Update for me and my voice. I mean, it probably sounds fine, but I've just been super congested. And for all those wondering, yep, I'm COVID testing once again. You can just never be too sure. I might even take one of the multi-tests if I have one left, because you just never know what you might have, or if you do have something. Alrighty, folks, that does it for Saturday's Virus Update. The next update will probably come on Monday. Stay tuned to my other channel, Climate Data Report. I may get something out tomorrow. I keep saying I will. Maybe I won't. I mean, this congestion is really bothering me. Anywho, if you're new to my channel, give this video a thumbs up and subscribe down below. Hit that notification bell. Share this video with anyone you know. And of course, leave your comments down below. I will see you all again on Monday, I hope. Until I see you again on Monday, stay safe. Have a fantastic weekend, and see everyone next week. Thanks for watching.